got a case study of a 32-year-old guy who had a complex injury playing football, valgus collision and a pivot. His MRI scan, when we saw him, showed a complete ACL rupture, an MCL grade 3 rupture that's now chronic and hasn't healed, and a medial meniscal red-on-red tear. So once we were in the knee, as you can see, the meniscus is very unstable. We used a shaver just to freshen things up to allow some bleeding edge and for it to heal. Using the first FiberStitch, measured it to 18, penetrating just above the meniscus into the posterior capsule, feeling it move through the capsule, then advancing the first suture device, rotating that wheel backwards, then all the way forwards, removing it back into the joint, going underneath the meniscus, again making sure that we can see where we're going, penetrating all the way through the capsule to the other side, again advancing the needle all the way backwards, all the way forwards until we feel that click, and bringing it out through the joint. We then identify the loop, pulling it, which tensions the first device, and then pulling on the long string, which brings the second suture taut. We then use the suture cutting device, bringing that into the knee and just trimming that off.